Today I am going to talk about a very burning topic which is known as frozen shoulder. Frozen shoulder has entered into the common terminology of layman. Any painful shoulder is considered to be frozen shoulder by the patient. It is not so. There are many other conditions which can mimic frozen shoulder. These are like Bankart lesion, rotator cuff tear, calcific tendinitis or shoulder arthritis. These are comparatively rarer. Frozen shoulder is the bulk of the condition which causes pain in the shoulder. Almost 80% of painful shoulders may be frozen shoulders. So what is frozen shoulder? Frozen shoulder is a condition in which the tissues around the shoulder become tight. So in frozen shoulder the tissues become tight and the shoulder movement becomes restricted. So the movement up becomes only so much. The patient cannot get the shoulder behind like this, and all this becomes painful. Some of these patients may have diabetes also, which requires correction. Now treatment for frozen shoulder is essentially conservative. So when the patient comes to me, I always start them on a conservative line of treatment, that is medication with muscle relaxants, exercise regime with the physiotherapy guidance, and home exercises. So these three are the pillars of treatment for frozen shoulder. After a good conservative trial, maybe about 1.5 months, if the patient is not responding that well, then the only option remaining is surgery. So previously we used to do open surgery, and open surgery sometimes is very messy, can give more pain compared to the previous condition. So what we are doing now in the last 10 years or so is arthroscopic surgery. Arthroscopy surgery is where you don't make big cuts, we make just one keyhole, another keyhole, and through one keyhole the arthroscope goes, through the other keyhole the working instrument goes, and with these two small keyholes we can finish the whole surgery inside, and the patient has very little pain, and the patient can start movement from the very second day, and the patient satisfaction is very good.